Welcome to the Basic Obstetric Ultrasound Training Course for Healthcare Providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials available at tinyurl.com/UW ultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams Waldorf, and I will be narrating this 11th video in our pregnancy ultrasound series. This video will focus on identifying the normal and abnormal placenta. Please visit our website for access to all of our video and training materials. There are 4 main skills you will learn in this lesson. You will learn how to identify the position of the placenta, evaluate for placenta previa, assess for placental abruption, and conduct appropriate follow-up and referrals if you suspect either condition. These are the key terms that we will use in this lesson. Placenta previa is a complication in which the placenta covers all or part of the opening of the cervix. Placental abruption means a separation of the placenta from the uterus. The placenta is the lifeline of the fetus. It transfers oxygen and nutrients from mother to baby and the baby's waste back to the mother for processing. Normally, the placenta also contributes to amniotic fluid production. We can begin to see the placenta on ultrasound at about 10 weeks. Look at the image on the left. Can you see the fetal abdomen, umbilical cord, and placenta? The right image shows the umbilical cord insertion into the fetal abdomen. Notice that the umbilical cord contains several vessels. Here we have labeled the structures to make them more obvious. The placenta is named or typed based on its position in the uterus. The position can be anterior, posterior, lateral, or fundal. This is an image of an anterior placenta. Here we have labeled the placenta to emphasize its location. This is an image of a posterior placenta. Here the placenta is labeled. These are transverse images of a uterus and placenta. Please pause the video now to identify the location of the placenta in each image. Please also identify the other structure in the right image. The placentas are now labeled in these images to show that in the left image we have a right lateral placenta. In the right image we have a left lateral placenta. The structure in the right image is the umbilical cord. This is a sagittal image. What is the placental location in this image? Please pause the video and ask a participant to identify the placental location. The placenta is at the fundus, or the top of the uterus. It is very important to identify where the placenta is located, particularly how close it is to the cervix. A normal placenta is at least 2 centimeters away from the internal os of the cervix. Remember that the internal os is the opening of the cervix closest to the fetus. If the placenta covers the cervix, there may be bleeding in the second and third trimesters or at the time of delivery, which can threaten the life of the mother. This condition is called placenta previa, and we will discuss it shortly. These patients must be referred for cesarean section to save the life of the mother. Assessing how close the placenta is to the cervix is fairly simple. First, we find the internal cervical os and then identify the lower edge of the placenta. Then we simply measure the distance between the lowest placental edge and the internal os. We will look at each step in more detail. The first step is to identify the cervix and internal os. Please pause the video and ask for 1 or 2 volunteers to point out the fetus, cervix, internal os, and bladder. Here we have identified the fetus, bladder, and cervix. Now we will remove the cervical outline to show the location of the internal cervical os. The calipers in the image are positioned at the internal and external cervical os. The cervical canal appears as a slightly darker line between the 2 calipers. In this image, please locate the lower edge of the placenta. Again, please pause the video and ask for a volunteer to point out the placental edge, placenta, and internal os. First, we will label the placental edge and the bladder. Next, we show the cervix. Here is the internal cervical os. The white calipers measure the distance between the placental edge and the internal os. The machine will display the measurement, as we see at the bottom of the screen. Is this measurement normal? The answer is yes. A measurement greater than 2 centimeters is normal. In this case, the distance is 3.25 centimeters. In the condition called placenta previa, the placenta is much closer to the os and may in fact cover it. There are 3 main types of placenta previa: low-lying, where the placenta is less than 2 centimeters from the os but does not cover it; marginal, where the placenta covers a part of the os; and complete, where the placenta covers the entire os. These illustrations show the difference between the 3 types. Here you can see that the complete previa covers the entire os, whereas the marginal previa covers only a part of the os, and the low-lying is less than 2 centimeters away from the os. This is how the low-lying placenta looks on ultrasound. Low-lying placentas are 2 centimeters or less from the internal os. Please pause the video and ask a participant to identify the placental edge and the internal os. Now we have labeled the placental edge and the internal os. We can see that the distance between the placenta and the os is 1.25 centimeters. The lower caliper is at the edge of the placenta, and the upper caliper is at the internal os. This is an image of a marginal previa. Can you find the placental edge and the internal os? Please pause the video now to give participants a chance to point out these structures. First, we will label the cervix and the placenta. Now, we remove the cervix label to show that the placental edge extends to the os. This is a marginal previa. Here, the white calipers measure the entire length of the cervix. This is an image of a complete previa. Can you identify the placental edge and the internal os? Please pause the video now to ask a volunteer to point out these structures. Here we have labeled the structures to make them more obvious. Notice how the placenta completely covers the os. Here again, the calipers measure the entire length of the cervix. The upper caliper is at the internal os. Often the cervix is easier to see during scanning than on still images, as you will see in hands-on training. Placenta previa does not usually develop later in pregnancy. If the first ultrasound shows normal placental position, previa will not develop later. In addition, a low-lying placenta or marginal previa that is seen early in the second trimester will often assume normal position by the time of birth with uterine growth. When you are scanning a patient that is less than 26 weeks with a normally positioned placenta and normal ultrasound, encourage her to return to your health center, abbreviated here as HC, for a screening ultrasound at 32 to 36 weeks. What should you do if you identify a placenta previa or marginal or low-lying placenta? Ask her to return for a follow-up ultrasound at 28 weeks. If the abnormality persists, send her to your referral hospital for a repeat ultrasound. Algorithms may vary somewhat according to local practice. You should consult your referral hospital for the algorithms appropriate for your practice. Note that in our algorithm, RH stands for referral hospital. If the patient has a low-lying placenta or placenta previa that is first noticed after 26 weeks, send her to the referral hospital to be rescanned. If the previa is confirmed, the obstetrician will most likely decide to perform a cesarean section to prevent massive bleeding before the onset of labor. Be aware that some conditions can distort how the placenta is truly positioned. For example, a full bladder can make the cervix appear longer than it is. If the bladder appears full, ask the patient to empty her bladder and then repeat the ultrasound. Also, contractions can push the placenta towards the internal os. If you suspect a low-lying placenta or previa, repeat the ultrasound in 30 minutes when there are no contractions. Let's consider how a full bladder might make the cervix appear longer than it really is. Here's an image of a cervix with a full bladder. The cervical length is 4.9 centimeters. After the woman empties her bladder, the cervix was measured again and was more than 1 centimeter shorter than previously measured. Now the cervix measures 3.7 centimeters. Let's look at how a contraction can affect the appearance of the placenta on ultrasound. The uterine muscle contracting can look just like placental tissue, which makes it difficult to see the placenta separately from the contracting uterine muscle. Please pause the video and ask a volunteer to identify the bladder, placental edge, cervix, and internal cervical os. Here we have labeled these structures. In the left image, a uterine contraction is pushing the placental edge towards the internal cervical os. In the right image, the uterus is not contracting, and the placenta can't even be seen in the same image as the cervix. This is another image before and after a uterine contraction. The left image shows how difficult it can be to distinguish the placenta from the contracting uterine muscle. Please pause the video now to ask a participant to identify the placenta, contracting uterine muscle, and cervix in both images. Here we have labeled these structures. The uterus is contracting in several places in the left image. The anterior uterus is contracting, which pushes the placenta down and closer to the cervix. The lower uterine segment close to the cervix is also contracting, which produces a bulge on either side of the cervix. Notice that when the contraction resolves, the placenta is far from the cervix. In fact, we cannot even see it on this image. In this image, the uterine muscle is contracting and pushing the anterior placenta down. Here we have outlined the uterine muscle and the anterior placenta to make their boundaries more obvious. Now we have removed the outlines so that you can see the structures more easily. Another condition of the placenta to watch for is placental abruption. This is when the placenta separates from the uterus. This usually occurs in the third trimester, but can also occur in the second trimester. Abruption can cause bleeding in the placenta or between the placenta and uterus. It can also cause abdominal pain, uterine tenderness, and vaginal bleeding. Placental abruption is a leading cause of maternal death, so it is critical to identify this condition. This is how placental abruption might appear on ultrasound. There is an abruption in each image. Please ask a participant to try to identify the abruption, which can appear behind or next to the placenta as an isoechoic or hypoechoic fluid collection. If the bleed has recently occurred, the fluid may appear hyperechoic. Here we have labeled the abruptions. In the left image, we can see a hypoechoic abruption extending from the edge of the placenta and filling the lower uterine segment. In the right image, the abruption is located behind the placenta and appears slightly hypoechoic to the surrounding tissues. This is called a retroplacental abruption because it is located behind the placenta. Abruption usually occurs at the edge of the placenta, but it may be in the placenta as well. It can appear hyperechoic, isoechoic, or hypoechoic, with more recent bleeds appearing hyperechoic and older bleeds appearing more hypoechoic. Even if you do not see an abruption on ultrasound, that does not mean that it hasn't occurred. In fact, ultrasound usually does not visualize abruption, and the diagnosis is more often made clinically. However, if you see ultrasound evidence of abruption, this is associated with worse outcomes for the mother and baby. Remember, abruption is possible even if you don't see it. Because ultrasound is not always reliable for abruption, we must also watch for clinical signs of abruption. These include second or third trimester uterine bleeding, sudden abdominal pain, and uterine tenderness. If you suspect abruption, refer to the hospital immediately. Placental abruption is a leading cause of maternal death. Let's review some of the recommendations from this lecture. What would you do if you found a low-lying placenta at 32 weeks? Send to the referral hospital for repeat scan. What should you do if you suspect a placenta previa? Rescan the patient after 30 minutes in case a contraction has given the appearance of a previa. What should you do if you suspect an abruption? The answer is immediately refer to the hospital. This is a leading cause of maternal death. What should you do if you identify a marginal previa at 32 weeks? The answer is to send her to the referral hospital for a repeat scan. Let's review some key points. If you identify a low-lying placenta or placenta previa, refer to the hospital if the abnormality persists on a scan at 28 weeks or later. Bleeding may be caused by abruption or placenta previa. All patients with second or third trimester bleeding need urgent hospital referral. Here are questions for review. Why is it important to locate the placenta? If the placenta covers the os, like in a previa, it can cause massive bleeding during pregnancy or delivery. How far should a normal placenta be located from the internal os? The answer is more than 2 centimeters. How close to the cervix must the placenta be if it is low-lying? The answer is 2 centimeters or less. What 2 conditions can affect the position of the placenta? The answer is a full bladder and a contraction. What symptoms will a mother have if there is a placental abruption? The answer is abdominal pain, uterine tenderness, and bleeding. If you identify a previa before 28 weeks, what should you do? The answer is a follow-up scan at 28 weeks. Send to the referral hospital if a previa persists. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause the video now to ask your instructor any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, Stacy Lissett, and Jennifer Summers. Finally, we wish to thank Dr. William Marks for the use of images from his book, Ultrasound: A Practical Approach, and Jennifer Summers and Jan Hamanishi for graphic design and illustrations. The University of Washington Department of Radiology has used this ultrasound course to train healthcare workers in many parts of the world. If you have questions about this video or course, please contact Dr. Nathan, Dr. Marks, or Dr. Adams Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies. Please visit our website at tinyurl.com/UW ultrasound to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original Basic Obstetric Ultrasound training course for midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.